Cervical cancer is the second most common cancer of women worldwide. 99.7% of the cervical cancers are caused by persistent infection with the human papilloma virus. There are over 100 types of the virus, of which 40 types affect the genital areas. Over the last 30 years, screening programs have effectively reduced the death rates by more than 50%. Cervical cancer screening can be done by a pap smear test, also called as the smear test, and by the HPV testing. All women who have ever been sexually active should undergo cervical cancer screening. Women under 21 years of age should not be screened. Women between 21 to 29 years of age should be screened by the pap smear test every 3 years. From 30 years till 65 years, they should undergo a pap smear test alone every 3 years, or if it is tested along with the HPV, they should undergo screening every 5 years. Women after 65 years of age can stop cervical cancer screening if all their smears have been normal over the past 10 years and they did not have any pre-cancer or cancer over the last 20 years. A woman who has had hysterectomy, that is removal of the uterus and the cervix, should stop cervical cancer screening. If the cervix has been preserved, then she should undergo screening as per guidelines. Educate and encourage women to undergo regular cervical cancer screening, to stop smoking, and to provide sexual health education in schools and to women. We take a pledge, we'll treat you well.